It's really hard to get through this life without having some level of trauma. And when we think of it, we often think of a car accident or an earthquake, but often the trauma that really impacts us heavily is the kind that is from another person, usually someone we love. And this can be child abuse, neglect, going through a divorce as a child where you don't understand what's going on. It's anything in your life that makes you feel like you or someone you love is at risk. And trauma is more about how we encode something in our brain than it is about the actual event. So often when we see clients come in, they don't even realize or recognize that they've had trauma. And they're often just playing whack-a-mole with various symptoms, not realizing that the underlying thing feeding those symptoms is this unresolved trauma. You have to remember that often the trauma that we endure happened to us when we were much smaller, much younger, and much more vulnerable. And the things that now wouldn't be a big deal as a child were really a big deal. They really made a big impact on how we saw the world and ourselves in the world. And trauma, it's really important for you to know, is an injury and not an illness. This means it is highly treatable. It has a range of confusing symptoms that go with it, and doesn't always manifest in a full-fledged PTSD, but often can be anxiety, hypervigilance, a difficulty connecting with other people. It can mess up our attachment. One of the ways that I describe it is we build these fortresses of protection, but then somewhere along the way we lose the key and the fortress becomes a prison. And so you're wanting to let safe people into your life and you find yourself sabotaging relationships or not being able to make a connection. Often that's linked to early trauma with people that we love. So there are very good evidence-based treatment therapies that you can go through and that a trained Thrive therapist can help you with and lead you through so that you can heal this injury and be stronger on the backside of it. You can have post-traumatic growth, which means you're gonna have all the benefits and lose all of those symptoms that are getting in the way for you living fully. So if you think you've had trauma, or you have any question in your mind, you're having symptoms that maybe don't even remember or can identify what that trauma is, which is not uncommon if minimizing has been one of your coping skills, then reach out and talk to a Thrive therapist today.